AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, MD.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health for every day. Our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fast-standing health topics, and of course where we do encourage you to call in and join in. Today, Monday morning version on our show, an interesting guest today. Every so often we get the opportunity to call upon him to come in and just spread a little bit of sunshine around and allow you to hear from a board-certified cardiologist what he does, giving you the opportunity to ask the cardiologist. You may have cardiovascular issues brewing between yourself and your doctor right now. Maybe you need a little bit of perspective about what all the fuss is about, if there's any fuss at all, or just a query on the issue of your heart and vascular system. Dr. Oliver Caminos has been affiliated with this operation for the last 11 years. And over that time frame, there's been sporadic times when we brought him to our airways. We're doing so today. If in the course of our discussion with him you want to call in to make a question, ask a comment, the number will be 412-825-6262. That's 412-825-6262. It's Ask the Cardiologist today. Now, as the week rolls on Wednesday's show, I've been spending some time now on the computer pulling on a specific topic. And I got to tell you, if you have children or grandchildren, you don't want to miss this show on Wednesday. We're finally going to delve into this issue. Some new information has come my way with respect to the risks and hazards of CT scanning. And with respect to kids, the risk is unbelievably high. We want to make certain that you, as a grandparent or as a parent, or just as an acquaintance of somebody who might have a young child, there needs to be an awareness and an understanding of what information you better be asking for the next time you show up at your local hospital. Anyway, on Wednesday, you want to run the recorders on Wednesday, it'll be a platinum version of the show. As we get to Friday, we will completely open it up for you on Friday with an open phone, get out of town version of the show, which I understand will be greeting us with another round of snow and cold, with up and down and up and down. Oh my goodness gracious. Anyway, nice to see how nice it's going to be out there today. Sun just blaring through my windows here in the office. Okay. Some business things to get out of hand. MCG testing, we're really well underway now. You are responding. We're getting phone calls from you. We've announced it on the air that we're making a sort of an attempt to re-identify those who have had MCG testing in the past. Don't be surprised if you're one of the original few hundred patients that you get a phone call from us, just to let you know what your status is with respect to the MCG. If the first test result of your multifunctional cardiogram, that's what MCG stands for, was good, then you were at least able to repeat that test a year later. You, and only you, know how much time has elapsed. But, well, no, I won't say only you. We do too. We're just calling to let you know that it may be time to do it again. The insurer completely covers this study now, as they've done in the past. And, of course, the results of this are then gone over between you and myself. Find out what implications there may be, and if there is a pathological impetus to the implications, then how to correct this is the way to take the best results, to take any results and make them work in your favor for your particular own health history. So MCG testing, you can give us a call, by the way, The testing goes on in both offices. We have the device every other week. The next time for testing in Monroeville is going to be next Monday and next Thursday, so you can call up if you have a mind to be tested to get scheduled on those days in the Monroeville office, and then the remaining days, 19, 20, and 22 of next week here in the McMurray office. The number to do that, 724-942-3002. LDA is well underway now. We're just coming to the end of the antigen life cycle. And so if you have had LDA in the past, you probably already completed your second round of LDA injections. So there's a whole crew of newer folks who glommed on to the older folks. And now when we get to round 3, which won't be until March, now we'll be getting the new antigen sometime at the middle of March, and so you can start to come in now to discuss whether or not you might think that LDA, low-dose antigen therapy, the immunological correction treatment that just has been absent in the conventional medical realm, this is a completely legitimate and very safe way to rid yourself of some diseases, and you know what they are, some 66 of them. If you have some questions about LDA, let me turn you on to a website that will really answer those questions for you in terms of reading material. The website is the website of Dr. William Butch Schrader. He's the godfather of LDA here in the United States, and his website is drschrader.com. That's doctor without a period at the end of it. Dr. Schrader, spelled S-H-R-A-D-E-R, drschrader.com. There's everything you could possibly want to read about LDA at that website. And if you want to just hear what we've done here, of course, in the month of November, we had LDA Fridays every single weekend of the month. On the 2nd of November, and this is why I mentioned it, you can go to the archives, my archives, at djcmd.com. Opening page, click on archives, an icon that's marked there. What then opens up is a screen with a giant list, a chronological list of all the radio shows we've done from present all the way back to 2006. Anyway, scroll to November 2012, not too long ago. On the 2nd of November, you'll be able to hear the show done by the godfather himself, Dr. Butch Schrader. The following week, on the 9th, we have Dr. John Wyckoff, a disciple of the good Dr. Butch Schrader. He hails from Lansing, Michigan, talking about autoimmune disease. Then on the 16th and on the 30th, remember, we'll skip there in between because of Thanksgiving, Dr. Kathleen Janelle talking about the GI disorders and how correctable they are. And it was a phenomenal set of shows back to back to back. Once again, djcmd.com. Click on archives. Head for November 2012 to November 2nd, 9th, 16th, and 30th are the shows you want to listen to. And then you can probably get a good idea as to whether or not LDA may be something you'd like to pursue. Product-wise, don't forget, Epicor has its new resurgence. You brought it to my attention. A tablet a day keeps the doctor away, and it has proven itself to be a great winner over all these years. The F21 sugar blocker, likewise, able to be obtained here. Also on the website at dcourtney.goludax. That Ludax, by the way, has 2 X's. Goludax.com, and you'll be able to order this up, even get it at a wholesale price of $50 a bottle, preventing the absorption from any of the sugars that you happen to be consuming. Okay, enough of that preliminary information. Let's just push it aside for now and take a short break. Here's your opportunity, folks. Would you like to speak to a cardiologist? Love to have an opportunity to do it? Well, we're going to give you that shot. Our cardiologist, Dr. Oliver Caminos, is our special guest today. We'll be right back in a moment with Dr. Oliver.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Always feeling tired, stressed? You turn to food to feel better and still wind up tired, stressed, and overweight. We at Avenue to Wellness can help. Using medications and nutritional supplements, we can help you control your appetite, relieve your stress, and give you the energy to enjoy life. These are powerful medications and supplements that only a doctor can prescribe. Dr. Sherman at Avenue to Wellness can create the plan that works best for you. Call 412-646-1063 for a free computerized evaluation. Stop suffering and give yourself the gift of happiness. 412-646-1063. Start on the path to more energy and less stress. 412-646-1063.
Hey, good morning, ladies and gentlemen. Welcome back once again to An Impact on Your Health. Right here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today in the Monday morning version of our show. Right outside. Great day, folks. Hope you enjoy it. And I hope you enjoy our show today because it's only every so often that we have the opportunity to bring a gentleman who not only has been a good friend but a great colleague with respect to management of patients that come through my office. 11 years ago, so not long ago, 11 years ago, I needed the services of a cardiologist and what a cardiologist could offer into my office. This gentleman just stood out above all others at that time. He's continued to remain that way and has excelled as a cardiologist for all those years. I refer to him as my cardiologist, but I don't mean that in a possessive way. I just mean affectionately this gentleman has provided a way to assess and learn about the cardiovascular status of an individual in a way no other cardiologist that I know of even do. For that reason, we've maintained a very tight and close relationship. I bring him to you today, and I say, you know what? You want to talk to a cardiologist? You got one. His name is Dr. Oliver Caminos. And we say good morning and welcome, Oliver. Thanks for coming aboard today.
Dr. Courtney, thank you very much for your words. And I really enjoyed the relation that we have for so many years. And,
you know, really, 11 years, Oliver. You know that, 11 years.
I never realized. It's getting old. We should be tested ourselves. It's just that you do such a great job at what you do. And you've taken on, it's plenty of cardiologists. My God, what a specialty. How well represented it is. Thousands of cardiologists here, I'm going to guess, in the Western Pennsylvania area. But you're kind of above, Oliver, and from the very earliest beginnings of your movement into the medical profession, testing, evaluating appeared to be your niche. Why? And this is not the crusade of many of the other of your colleagues in the cardiology world. You've taken on the mission of providing an evaluation and testing that doesn't seem to have an equal, at least as I look at it. Why so? Why did you move into that direction? In reality, my philosophy is the one of detecting what I call the silent killers of modern civilizations in the early stages, before they strike the patient. These are mostly silent diseases, and cardiology and medicine in general are specialized on treating these problems after they strike the patient. And we like to specialize on detecting these problems before they do that, before they strike the patient, before they give you the stroke, before they give you the heart attack, before the abdominal aortic aneurysm breaks, before the arteries of your legs get clogged and occluded. So to me, that's the name of the game. This is like preventing a fire
versus having a fire department putting the fires away. We believe that both sides of the spectrum in terms of treating diseases are needed, so we specialize on the side of detecting these problems, what I call the silent killers of modern civilization, before they strike the patient. As you probably know, the number one killer, I'm talking about patients older than 55, 50, 60 years of age, and which is the kind of patient that we mostly see. I congratulate you, by the way, because this is also, I understand, your vision. And more detection, more non-invasive treatment. Today, you know, invasive treatment, an excessive number of medications, etc. I'm not saying that they are not needed, but they are being, it's kind of an abuse in relation to what is really needed, and is detecting these problems in a stage we can really make a difference and prevent the catheterization, prevent the stenting, prevent the stroke, prevent the heart attack. This is our mission. And I think, it's not that I think, I know it's your philosophy too. And as you probably know, the 65 to 70% of the people that are struck by catastrophic diseases or deadly situations today in the modern countries are killed or affected by, number one, coronary artery disease, which account for 25%, 20 to 25% of the patients dying in the U.S. today. Follow, and by the way, the cause of coronary artery disease is atherosclerosis, followed by strokes, another 18-20%, also caused by atherosclerosis, followed by cancer. Then we have a number of diseases related to the hypertension and diabetes that produce atherosclerosis. And finally, number 5 group is the rupture of abdominal aortic aneurysm, blockages in the arteries of the renal arteries and the arteries bringing blood to the extremities, most of the time lower extremities. These diseases, they have one common feature, and they are silent. Many times I ask my patients, do you know why these diseases are silent? And they look at me like saying, well, why are you asking me? Well, these diseases are silent, I tell them, because I suspect that Mother Nature doesn't want us to know that we have them. Mother Nature is like Mother Nature. Ultimate mission is to kill us all, just to leave room for another generation. So we have to, as doctors, be able to detect these diseases before they strike us, because in that silent stage is when treatment really makes a difference. After they strike us, the only thing we can do is just go and repair the damage. But before they strike us, we can prevent the damage. This is a real way to do medicine today in the 21. Sometimes I forget that I'm in the 21st century, you know.
Yeah, we're here all.
We are here already.
We're in a population that's aging, and you're right. We probably.
And, you know, in a certain way, continue on the mentality of the doctors and medicine continues to be the one from the 20th century. In the 19th century, abuses of the hospital, the emergency room, about of testing once the problems strike you. Coming late. And the philosophy, believe it or not, is not changing much. And, but anyhow, this is what we do. We are specializing on detecting these diseases before they strike you. And in a couple of hours, as you know, we can do that job by using our facility, our diagnostic facility that we have in McMurray, and our main office is in Monroeville, Pennsylvania. That I would say, and I really believe it, is one of the practices and offices on the outpatient environment best equipped in not only Pennsylvania, but probably in the eastern part of the U.S. And so that allows us, all that technology allows us in a very economical way, simple way, to evaluate the patient, the carotid arteries, check for plaque in the abdominal aorta, an echocardiogram, treadmills, nucleus, whatever is needed to early detect these diseases, the diabetes, the hypertension, the coronary artery disease, the enlargement of the abdominal aorta, blockages in the carotid artery, blockages in the legs, and blockages in the renal arteries, etc. In the early stages, as I was saying, so allowing us to be able to treat the patient in that stage of the problem and making a real difference in the future of the patient's life. In certain way, this is a legal way, I would say, of promoting life prolongation. Because if I can prevent you or anybody from having a heart attack or stroke, this is the real way to prolong the life of that patient. He might not realize, but this is the real way. And so this is what we do. I know you know that well. And
I would love the opportunity for our listeners to hear about this. Not too often that we get to have a chance to bring you aboard. Yes, what you do over and above is one of the finest evaluations that can be obtained. Literally, you're probably right about that in the eastern United States. For sure, in the western Pennsylvania region, the two offices that you mainly are able to be involved with because, distance and spreading yourself thin are problems. But for 11 years, you've been coming to my office literally every other week, bringing yourself here, your entire staff, all of your technicians, your phlebotomists, everybody jumps in a couple of hours, like you say, all the testing that could possibly be done to detect those silent killers is put into play. Even better done in your Monroeville office, which is your home base. But little known by our listeners is other doctors across this area want that kind of testing, and actually you have mobile units that you dispatch to a whole, you go far east of Harrisburg, don't you, Doc?
Well, we are going to several places. However, many doctors, they use our diagnostic services, do not necessarily apply our philosophy. But when I say we, I mean you and myself working together, and we do the testing that you request, and that testing is geared to the early detection of these diseases. And if the patient already had the disease already well known because he already had bypass surgery or coronary artery disease, diabetes, etc., we'll find out in a brief, short period of time how is that problem at that particular stage, even immediately in our office. We do have the laboratories in the place, so allowing us to, in few minutes, in a couple of hours, I would say, to detect and inform the patient and on the spectrum of things that we are evaluating. And this evaluation varies sometimes depending on the patient age, history, etc. However, I emphasize that, as mentioned before, the 5 silent killers of civilizations, the modern civilization, they are the ones that kill 60 to 70% of the individuals. So we have to put all our bullets in these diseases. And if the patient has something else, it will show up probably in our lab work, anemias, etc. And that will be probably accidental findings. But our concentration is in general on these diseases, which are getting epidemic proportions today, and we are getting so used of seeing our friends and patients and individuals all over the country being hit by these problems, because all of them are silent. Coronary artery disease, up until you have the heart attack, most of the time is silent. A lot of people think that coronary artery disease gives you chest pain, but that's not true 70% of the cases. I mean, when they give you chest pain, many patients attribute that chest pain to indigestion, etc., human nature, and they are kind of afraid they fear the diseases, so they convince themselves they have something way more benign. The same with strokes. Strokes hit you in the middle of a party with your family, and all of a sudden you're in the floor, unconscious, and the rupture. Nothing to say about rupture of abdominal aortic aneurysm, and diseases like diabetes and hypertension and blockages in the legs, etc. This is a real epidemic, and this is where we concentrate. And incidentally or accidentally, we get all the spectrum of all the other problems detected as you might have them. Or if the patient is healthy, we are able to tell the patient, well, listen, relax, this is normal, you don't have any blockages. Or if you do have a minimal degree of blockage, doesn't need any treatment at this time. We can then concentrate on these patients in diet, weight reduction, prevention of the atherosclerosis, which is, by the way, out of the 5 silent killers, 4 of these silent killers are related to atherosclerosis. Yeah. We specialize in our laboratories on detecting what stage the atherosclerosis in the patient, not only just by checking the cholesterol, which is a very, I would say, almost naive way of testing for atherosclerosis. so basic to so elemental. But we can just see the plaque, visualize whether or not that plaque is 10%, 20%, 50%, 80%, 99% occlusive. How will the plaque form? Is a soft plaque, calcific plaque, with blood clots, without blood clots? All that information allows us, and the doctors, and you in your case, to provide the patient with an intelligent treatment. So we are not going to be giving patients treatments for life that they probably don't need. Some people, they might have a high cholesterol, however, they don't have any plaques, so they don't need that much treatment with cholesterol drugs, which are so expensive and they produce so many side effects. On other individuals, they might have moderate elevation of the cholesterol, and however, a lot of plaques, and the philosophy of treatment, consequently, is different. This is the way we practice medicine, so we can provide you and your patients, and my patients alike, and with an intelligent treatment and assessment. And many times, fortunately, we find out that problems are not existent on part of family history, etc. So that's good news, and this is the way to prevent unnecessary concerns and treatments and abuse of different drugs like statins, etc. So common seen today.
Now, I'm going to be asking you about some specific studies that you do and let you elaborate and illuminate how you look at those as a cardiologist. I would say for our listeners out there, if you are being managed by your current doctor, I guarantee you that you will benefit from having this complete evaluation, and you can ask for it without having to ask your doctor to get it. I think if you just wait around thinking, well, your doctor's a nice man, he probably is, and he knows your history very well, but the extensiveness of the workups that are being done in the offices are not anywhere on par with what we're talking about here. If you feel, and if you felt, that you'd love to be able to have that complete evaluation, you should keep in mind that you can get it, and you can contact either this office at 724-942-3002, or directly call out there in the Monroe office and see Dr. Caminos. Dr. Caminos, which office phone number out there do you prefer that people contact you on?
Well, I suggest that they can call you, and but our office is our main office in Monroeville is 412-963-1844. No, excuse me, and 372-2035. 412-273-2035 or 36. And or they can go directly through your office and your services, and you'll be the one prescribing and advising us on what testing to be performed. We are working together on this front for so many years.
A lot of years.
And you know perfectly well what needs done, and if I feel that something else needs added, I will do it with your permission.
Absolutely. Let's take a little trip through some of these studies, because these are studies that we would hope that the listeners out there are getting. My guess is, and it's only rare that I have a patient that says, oh, I've had all those done. I have plenty that say, oh, I just had a workup from my doctor, and when I start getting into it, I find out that has been some poultry lab work, blood work, and occasionally it's an echocardiogram, very occasionally, by the way, and it's usually not much beyond that. Now, with that being said, Doc, could we sort of maybe tiptoe through some of the studies that you do, because they are so illustrative and illuminate these silent killers that you're talking about, that I love to have my listeners hear from you why you feel they're important enough and actually you do them routinely here and in your offices in Monroeville. So, well, you know what they are. Why don't you just take a walk through and mention one of the studies that gets done on every evaluation, and as a cardiologist, why you felt the study was important, and as you evaluate these, as a cardiologist, what do you uncover, and how are you able to correct?
Well, Dr. Courtney, and as I said before, these diseases are mostly silent. However, if we dig enough on the patients, many times they do have either family history, subtle symptoms, past remote episodes that make us suspicious of different problems. Just the age of the patient by itself, if you're 70, 75, 65 years of age, chances are quite significant that you're going to have to a certain degree one of these problems in the early stages. So, number one, of course, is to take a very detailed history of the patient, helped by our computers, and family history, etc., medication he's taking, or he was taking in the past, etc., or he's maybe not taking anything. And maybe it's a patient that feels that he's totally asymptomatic and feeling great, but he want to know based on his family history, etc. Then we do have the introduction of the laboratory testing. Many doctors are checking cholesterol, etc., but we do have special testing for detecting within the family of cholesterol those fractions that really invade the artery. And I'm talking about the NMR, lipid profile, and another test that is specialized in atherosclerosis. And because just the cholesterol and triglycerides, the good and the bad cholesterol, is many times not enough. And secondly, if we suspect the presence of any plaque on the patient, we try to visualize that plaque on those areas that are easy to visualize and they are more important, like the carotid artery, for example, the abdominal aorta, and the lower extremities. Needless to say that these testings are almost mandatory in any patient with history of hypertension and diabetes, or previous history of any vascular problem, cardiac or else. And so by duplex and color mapping, we can visualize actually the carotid arteries, the abdominal aorta, the lower extremities, etc., and see whether or not there is any plaque, 10%, 20%, 50%, 80%, 90%. Sometimes we even find out occlusions already in patients could never feel any symptom whatsoever. So we have to visualize that we can do this testing in about half an hour, I would say. Then we do have in the intervention of the stress testing that can be done the same day in the office if needed. Stress test sometimes complemented by a nuclear test if needed. And simultaneously, we can check, for example, in the laboratory certain markers for malignant diseases, like, for example, PSA for prostate cancer. It's not to say that prostate cancer and PSA, they go hand by hand, because there is so much misinformation in that area, but PSA is still a very important test to be performed in individuals. It is not an absolute answer, but allows the physician to detect patients at high risk. We can check the size of the prostate, the dimensions and the weight of the prostate, and by doing transpubic sonography, which take about 10 minutes. In the same day of the visit, check also the urinary bladder, ruling for tumors of the urinary bladder, the prostate, etc. We can also do a CBC and differential, checking the red blood cells and the white blood cells, early detections of anemia, etc. Patients with moderate anemias, for example, after 60 years of age, regretfully, one of the causes of anemia is malignancy. So we had a plan to early detect all these diseases in that stage that we think might be worthwhile to detect for the future treatment, assuming the patient had the problem at a stage that needs treated. Sometimes we detect the disease, the plaque formation, for example, atherosclerosis on different arteries, and we tell the patient, listen, you have a 10% plaque here, 25% in this other place, but really other than diet and exercising is not needed at this point. We see again in 1 year, we'll keep on monitoring certain, so we don't need to treat with medications, and this is our aim, avoiding unnecessary treatments, and in a relatively large number of patients, I don't know the majority of patients, but a relatively large number of patients. So we, in that way, and using all the modern technology that we do have, can really put that patient in the real track. And occasionally we find out people with high cholesterol, for example, and different things, they don't have no plaque whatsoever. So we can tell them, listen, you don't need these medications. You don't need the blood thinners. You don't need the statins. Why are you going to be expending money and taking things that you don't need at this time? Your cholesterol is a little elevated, but there is no plaque formation in your arteries, for example. And so these technology allow us to act in that way, and the patient saves money, the insurance company saves money, and not only money, but you don't want to be taking yourself as a patient something that you don't need, really. And that might be not only expensive, but might be even dangerous for your life. And so this is I'm talking specifically about the statins, the Crestor, the different medications that so often we see in patients being taken for ages, and sometimes they don't even need them. We see them every other day. And so basically, in summary, this is what we do. We have the complete lab work with our lab department specialized in atherosclerosis. Of course, we can check for diabetes and all the routine that any laboratory can do. We have the laboratories in our offices in Monrovia. We provide lab testing for more than 250 places all over the western Pennsylvania, Harrisburg area, and eastern Ohio. And so our laboratory is very large, larger than many hospital labs in the city of Pittsburgh. And we do have a department of sonography and nuclear cardiology and nerve conduction testing for testing of sciatica, spinal stenosis, lumbar disc herniations, chronic back pain, etc. And so we do have all these arrangements of procedures that can be done tailored to each patient depending on the problems, of course, that can be done most of the time in one single visit, sometimes in a couple of visits. And that allow us to provide you, for example, in your patients, a complete evaluation and report on what needs to be done on those patients, paying attention to the specifics and the results of each one of these tests that we perform.
All right. There you have it, folks. That's the philosophy. That's the gentleman behind the philosophy. Now, he's going to be with us up to the top of the hour. If you want to call in and ask a question of a cardiologist, having that opportunity very rarely, today's the day to do it. 412-825-6262 is the number. That's 412-825-6262. We're going to take a short break. And Dr. Caminos, when we come back, I want to ask you a bit about something, well, that really brought us together. And there's something that's now really fulminantly available in both of our offices. That something is called ECP. I'd like for you to make some comments about it, if you would. Okay, Doc?
Very good.
Okay.
Excellent.
You're with Dr. Oliver Caminos this morning. We're going to take that short break. Remember, 412-825-6262. We'll be back in just a moment.
Tried and tried, but you cannot lose those pounds. Dr. Sherman and her staff will help you get rid of those pounds and keep them off. Dr. Sherman uses the latest advances in medications and meal replacements. No surgery, no fads. You will lose those pounds and keep them off. Call for a free consultation. 412-646-1063. Start on a path to a healthier, happier life. That's 412-646-1063.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Here in a Monday morning version of our show. Good friend of mine and competent physician in our area, a cardiologist extraordinaire, has graced our presence today. His name is Dr. Oliver Caminos, involved with a huge conglomerate company able to service, I didn't realize, 250 different locations. He dispatches and does blood work and does various studies for. The two main hubs of his office and practice, one main office, Monroeville, out there, brand new facility, just gorgeous building out there. And then every other week here in the office in McMurray. So if you want to be able to get that evaluation, feel free to give me a call. We'll get the old ball started for you, no matter whether you're in Monroeville or in McMurray. 724-942-3002 is the number. And we'll have you set up to be evaluated by both myself and then ordering the testing that needs to be done, ultimately by Dr. Oliver Caminos. So you have the opportunity today, if you have a mind to give us a call and ask any question on the heart and blood vessels. 412-825-6262 is that number. Dr. Oliver, you still with us, my friend?
Yes.
Okay. I wanted to take the opportunity to ask a question about something that really brought us together 11 years ago. At the time, it was really a rare bird for the western Pennsylvania area. Time has moved on. The awareness of this particular procedure has grown. I don't think nearly to the level it should have grown by now, but nonetheless, it has grown. And it's grown so much now that we're able to finally offer it in your offices right there in Monroeville, which is pretty new for us, only really originating in September 2012. What I'm talking about is something my listeners are very much aware of, something called ECP, stands for external concert pulsation, and I'd really love to have you spend some moments on this because you've grown over these 11 years, your philosophy of it has grown, and your embracing of it now is pretty much, it's clear to me that you fully jumped on this bandwagon. So could you please discuss ECP and how you see it as a cardiologist? After all, it is in your domain. You guys are the experts on ECP.
Yeah, I'll be glad to. In fact, we, as you probably know, within cardiology, I had a field that I specialize, which was, and it is, still is, the so-called end-stage cardiomyopathy. So as a consequence of that, I saw patients that many times they had bypass surgeries a couple of times, advanced diseases, and they start asking me way back for a procedure that they had heard that was named ECP. And then I accidentally find you, and I don't even remember how we hooked together at that time, but ECP was the answer for many of these patients that were just tired of bypasses and catheterizations and surgeries. And really I was initially, I would say, somewhat skeptic. By the way, ECP, one of the main developers of the ECP concept was the University of Pittsburgh here, the UPMC hospitals. And I don't know if they were the creators, but they were one of the...
There's no research. It's still being done.
Research was initiated by them.
Still being done there today, Doctor.
Exactly. So I was initially impressed by how many patients improving the chest pain, and initially, I'll be frank with you, I told you several times, I was a skeptic, and skeptical, I would say, thinking that probably more of that improvement just was accidental. But then as I started seeing more and more patients, even improving sometimes, memory and the viewing going down, actually ECP and the counterpulsation increases the circulation, not only on the coronary arteries, not only on patients with chest pain, but in patients with coronary artery disease and other blockages, by the nature of the procedure itself. I would say not a cure for everything, but it's an extremely important tool that cannot be overlooked today in many patients. Also, as you know better than me, the coronary artery disease and these kind of heart problems reduces what we call the heart left ventricle ejection fraction, the ability of the heart to pump blood. This is what we call ejection fraction. And the ECP helps in many patients to improve that debilitated heart. So improving the so-called ejection fraction. And this is so important in the mechanics and future evolution of patients in congestive failure, aside of whether or not they might or might not have chest pain. Chest pain is being a symptom that patients, and many times even the physicians, think that is the hallmark of coronary artery disease, when in reality is not. Because in my experience, and the new statistics are showing, coronary artery disease and of course stroke and other atherosclerotic diseases are mostly silent. And the first symptom, regretfully sometimes, is sudden death or a heart attack. And so ECP is a technology that you provide, it's a service that you provide in the offices, in your offices in Monroeville and McMurray, that helps and on the treatment of this disease and give us an alternative on many of these patients, not only on the end-stage phases, but in the initial phases too. It's another tool extremely important, And above everything is a non-invasive test, and this is, in my philosophy, one of the most valuable features of the ECP. And you do have, I understand, you offer another test which non-invasively can detect in a large percentage of patients the early stages of atherosclerosis and coronary artery disease. That you probably can expand on that concept.
That's that famous MCG, multifunctional cardiogram. And we've been offering it now in the Monroeville office as well as McMurray since February 2011 here, but most recently since August, September of last year, and even a little bit beyond out there. So I know that you feel very passionate about and really support the use of MCG. You think it is... Go ahead, comment about MCG, because I've watched you really come to embrace MCG testing for the ability that in this non-invasive way to assess the status of the coronary arteries and give you very good information and a tip-off without the need for a cardiac cath. So about MCG testing, you got any comments you want to make about it?
Well, I think it's an excellent screening test. You know, if any screening test is not 100%, but it's a simple, inexpensive test that takes a few minutes and allows the physician, your practice in this case, to early detect patients with a tendency or early or advanced stages of atherosclerosis in the coronary arteries and elsewhere that otherwise might go unnoticed because these diseases, as we mentioned before, are asymptomatic. And that's not to say that it's a 100% accurate test. The sensitivity and the so-called specificity is good enough to be a test to be taken into consideration, mainly because it's inexpensive, easy to be provided, and it takes few minutes to be done and allows the doctor to early detect certain patients at risk. That by itself is a tremendous feature of this test and a tremendous help to identify the patient that might need further workup, you know. So we cannot go working up every patient, every individual in the country. But so this allows you to be more selective and in a very inexpensive way, cost-effective way for the patient, the insurance, etc. And by the way, the testing that we do, and anybody actually can do for early detection of diseases, it saves economically. The economical impact on health is tremendous because by early detecting certain diseases, we prevent heart attacks, we prevent strokes, we prevent rupture of abdominal aortic aneurysms. So it's not that we do more testing for the sake of testing people. This is something that in the long range prevent diseases, reduce hospitalizations, reduce visits to the emergency room. But above everything, which in this era that we are so much concerned about the economics of the insurance companies, and we're trying to help the insurance companies. Sometimes we forget that we have to help the patient. And the patient is the number one beneficiary, because if I can give you the option, listen, you might have a heart attack December the 21, 2013, or I can prevent it. What way would you go? We like you, for sure, you're going to go the way of preventing the heart attack. And I said, Dr. Caminos, please prevent the heart attack. Give me the testing, we'll do whatever you need so I don't have that heart attack. By preventing or early detecting these diseases, I'm sure we have a tremendous impact on the health of the patient, the economy of the country, the insurance companies, and the pocket of the patient too. Because it's not only the insurance company the one that expends money. If the family is going to the hospital, taking the patient to the hospital, taxis, taking time off work, etc. And so this has a cascade of benefits that improve the life quality of not only the patient, but too many other people, relatives, sons, grandsons, etc. This is our mission and the way I see it.
Well, the issue of the specificity, 91% accurate as compared to the gold standard, which is the cardiac cath. But of course, the cath is there's all sorts of possibilities of risks and the side effects that although you get great information, no one's really asking to have a cath for the heck of it. You usually are in pretty bad shape in order to be taken to a cath lab. Here, as you mentioned, completely non-threatening, lying on a bed, fully clothed, to get a 91% accurate reading on what's in those coronary arteries. I agree with you, and that's why I know I enjoy bringing the device to your offices so that both my and your patients can benefit from it with respect to MCG testing. Thank you for the kind words, by the way, with respect to ECT, because we continue to be the largest facility here in Western Pennsylvania that is able to offer such testing, or such a procedure. I would ask you one other question. It keeps coming up over and over again here during my radio show about arrhythmias, and in particular, one particular arrhythmia, AFib. Could you share with our listeners who evidently suffer from this at a pretty high rate? By the way, is this really common? How common is it? I see it happen so many times, and it comes up over and over again on the radio show. So what about AFib, Doc? How frequent is it detectable? How much the treatment is necessary? What kind of treatments are needed in order to get this thing under control? Can it be reversed? Take a few moments and talk about atrial fibrillation.
I'll be glad to. Atrial fibrillation is very frequent, and is one of probably the most frequent significant arrhythmia that we see today. We have different arrhythmia that can affect a patient. Isolated premature atrial contractions, very common. Most of the time an innocent situation that might not need any treatment. Isolated premature ventricular contractions. A little bit more significant, might not need any treatment. Patients might need evaluation because premature ventricular contractions, as also premature atrial beat sometimes, they might be the indication that something wrong is behind. And then we do have the atrial fibrillation, and finally the worst, which is the ventricular tachycardia and ventricular fibrillation, most of the time semi-lethal diseases, I would say. However, the atrial fibrillation is probably the most impacting arrhythmia today for a combination of factors. Number one, its frequency is relatively way more frequent than ventricular tachycardia and atrial fibrillation, which are all the worse by nature, but they don't occur, not even the 10% of the times atrial fibrillation can occur. Ventricular tachycardia, ventricular fibrillations, and the arrhythmias that we see usually 10 stages of the diseases and atherosclerotic coronary artery disease, etc. Atrial fibrillation, on the other hand, is relatively frequent. For many, many years, doctors thought it was a benign arrhythmia, easy to control with digoxin, do sometimes cardioversions. Then the ablation came into the game, and but then realized that atrial fibrillation was the number one or the number two cause of strokes in patients.
And why is that, Doc? Because I know the relationship exists, and most patients do, but they don't quite understand what the relationship is between stroke and AFib.
Well, in the atrial fibrillation, as the name indicates, the atrium, which is one of the two kinds of chambers that the heart has, we have two atriums and two ventricles. The ventricles, they pump, the atrium also pumps. The atriums, they don't pump that much. Actually, the atriums are responsible for about 10 to 12 to 15% of the cardiac output. So if they fibrillate, I mean, they stop contracting, but they fibrillate, they become tremulous.
Yeah, quiver. They like quiver.
Yeah. Sometimes the patient doesn't even feel anything. So, or sometimes the patient might feel a little shortness of breath, palpitations, depending on the rate, because we have two kinds of atrial fibrillation. Uncontrolled, the ventricular rate is very fast. Boom, 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 boom. Uncontrolled, the ventricular rate is irregular, but within normal limits. Boom, 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 boom. So, it's a controlled atrial fibrillation. Doctors, sometimes we find patients with uncontrolled atrial fibrillation, and if we bring it to controlled atrial fibrillation, mainly in the elderly, we can live forever, sometimes with a controlled atrial fibrillation, without having to revert the rhythm to normal. In theory, the ideal situation will be to revert this arrhythmia to a normal rhythm. But for different reasons, age of the patient, etc., sometimes it cannot be done. Or sometimes patient might not like to do this. Or sometimes we convert it to normal rhythm and the patient converts again into atrial fibrillation and again. So at a certain point, as I always said, the atrial fibrillation tends to win. Today we do have another way of controlling atrial fibrillation, which is ablation. The ablation is a kind of specialized catheterization performed by the electrophysiologists, which are specialized cardiologists that introduce a catheter on the right side, the chambers of the heart, goes to the left side, the chambers of the atriums, and a blade, it like burn with high frequency, the areas or the points that are producing that arrhythmia. And sometimes, in a large percentage of cases, 80–90%, controlling the atrial fibrillation most of the time, forever. But it's an invasive procedure which has improved dramatically in the last few years. And the atrial fibrillation, to answer your question, is the number 2, or sometimes the number 1 cause of stroke today. The other cause is blockages in the carotid artery, the artery that delivers the blood to the brain. So between these two diseases, they are the cause of 90% of the strokes that patients suffer today. Atrial fibrillation being today more and more significant. I don't know why, but this is a trend that we see, and which is in some way alarming. And this is why patients with atrial fibrillation are being given blood thinners. And what happens is that when the atriums quiver, as you said, they tend to form in certain sections of the atriums. They turn to form, they don't contract anymore, little tiny blood clots. And as the atriums are not contracting effectively as they should do it in normal situations, they tend to form inside these little blood clots, and occasionally these blood clots, they go to the ventricles, and there they are pumped and go to the brain, or they go to many other parts of the body that producing mini, micro infarcts, I would say, and that many times they go unnoticed. The brain, which is so sensitive to any little change, will respond with dramatic symptoms, from TIAs, transient ischemic attacks, to frank, large strokes. And so atrial fibrillation, by allowing the atriums to build up little or large, sometimes, blood clots, is the number 1, and sometimes the number 2, and sometimes even the number 1 cause of strokes today.
You know what? The hour has passed that quickly. That's how things fly when you're on board. I want to thank you so much for coming aboard today and allowing our listeners to hear your philosophical approach to the treatment of cardiovascular disease and those silent killers. We'll have you back again in the future. I'm going to extend that invitation. Until then, I'm going to say so long to you. So long to you out there, too.
And Dr. Courtney, thank you for allowing me to participate in your great program, okay? Extremely educational for everybody, including doctors. Thank you again.
Bye now. See you on Wednesday, folks. CT scanning. Bye now.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney